What's up, everybody? I'm so excited to have you here today for one of our most requested topics, and probably, in my opinion, one of the most misunderstood when it comes to how to have a cash practice. It's not just as simple as saying, I'm going to have a cash practice, because, again, the rules and regulations still apply. And Dr. Mario, who is our go to guy, Heather and I, bless his heart. Um, we text him, email him, call him with every one of our questions because he knows he's got all of this amazing experience. And thankfully, he is so open and willing to share that information. So we're super excited to have him here today. So, just a little bit about Dr. Mario. Um, has been a member of the Carrier Advisory Committee for Medicare. He's a certified professional compliance officer, a certified medical compliance specialist. Um, he's got certifications in so much stuff. You see all these beautiful names initials behind his names. It almost looks like Dr. Evan Williams. He's a diplomat of the Academy of Integrative Pain Management, and he has been presenting continuing education classes for over 20 years as a national speaker on everything from Medicare clinical documentation, ICD-10, compliance, HIPAA. But what I love most about Dr. Mario, and what I appreciated most when I came into the chiropractic profession just a little over a decade ago, was his ability to break it down in a no-nonsense manner so that anyone can understand it, whether you've been in this profession for 5 minutes or 50 years. Because the reality is, the rules, the regulations, the way they have everything set up, it is not always written in an easy, digestible way to absorb that information and then utilize that information in your practice. But Dr. Mario, he blows all those barriers out of the way so that you and your team are able to take what he talks about and implement it into your office the very next day. So, Dr. Mario, thank you so much for being here today.
Thank you, Christy, and welcome to everybody. So 2 things. Number one, I'm glad she qualified. When she said the most misunderstood, I thought she was talking about me, but luckily it was that. And then when a southern gal says "bless your heart," I always wonder what she's really thinking. So it's my pleasure to be with all of you here today, and we're going to talk about a subject that's really near and dear to my heart, as well as probably yours here, because it's difficult to be in practice nowadays here. I actually retired from my practice, and now I work full-time consulting and being a compliance officer for Curis Functional Health and other clients as well. But I was in practice for 35 years, and it's a lot different here. As Christy said, I'm certified in a lot of things here, but the main thing is, as being a professional compliance officer and, working with NCMIC and Foot Lovers and ChiroHealthUSA, I see things that it's like, did you really know what the laws are? So let's just jump right into it and talk about it here. And keep in mind, there are a lot of changes. Even HIPAA is changing. We just had the No Surprises Act, which I will talk about some today too. So if you go to facebook.com/askmario, make sure you do the /askmario. I don't get your email. It's not a spam. It's not a sell job. All it is a place where you can have a home to get information as it happens. All you got to do is like me, put me in your notifications. And if you don't do Facebook, hey, get somebody in the office, or maybe both of you in the office. That way somebody always catches what I post there. So facebook.com/askmario. Okay, let's go ahead and get into talking about the cash practice. And, when we talk about the cash practice here, there's a lot of decisions to be made. And I'm saying this from the heart here. And if you're tuning in, and there's about 150 of you here live today, and it'll be on demand as well. But the key is that you have to take into into account all the business aspects of having a cash practice. NCMIC actually has said in the past that nowadays it's the cash practice and the cash patient that most often is suing a chiropractor. So it's like, okay, I want to become a high-risk practice. Okay, let's get into a cash practice. So you're not ducking out of anything, but it's a business decision. And I think a wise business decision, as long as you're doing it legally, ethically, and it lets you sleep at night as well. There's many reasons why doctors and chiropractors, more specifically here, get into a cash practice. And finally, I don't want to be on the insurance treadmill. I've heard that from some of my friends in the past there, and it's like I'm sick of all these regulations and Medicare and all this other stuff here, and I just want to be my own person, my own boss here, not answer to anybody, and just pay me cash. And is this really a reality, Mario? And the answer is, you really need to examine and look at all the situations from all sides and then make a decision. And, having an all insurance practice or an all cash practice or a hybrid practice, you got to choose which one is best for you, best for your office, best for your community, best for your peace of mind and your philosophy in general. So let's look at all the things here, and I'm going to go through them. And again, if you have that pad of paper, I always recommend, and a pen, take notes here. And if you're not doing something, then consider adding it into your office. And if you need help, ChiroHealthUSA or my email, doc@askmario.com, is at the end of these notes, at the end of the slides here. And so doc@askmario.com. Send me an email and let's see what we can do. So let's just look at this here. Okay, number one, I know you're talking about a cash practice, so the first thing he talks about is insurance. Well, think about it here. Insurance companies, number one, a PPO. Now, a PPO is a preferred provider organization. And when I ask doctors, why do you get into a PPO? And they go, well, I don't know. And I go, well, why do you take that PPO discount, the reduction? Sometimes the reduction is ridiculous. It's like when Medicare starts looking good compared to a certain PPO, it's like, wait a second, what's going on here? And the fact of the matter is that when you get into a PPO, and Medicare is a PPO, by the way, okay? But when you get into a PPO like Blue Cross, it's a two-way street. It's not a one-way street. The two-way street is, I will take a reduction in as long as it's, business-wise good, I'll take a reduction in my reimbursement as long as you're sending me patients. So what PPOs should you stay in? Well, number one, how much is it worth to you? Who's your major employers in your city? Do they have a PPO like Blue Cross? And does it cover chiropractic? And what hoops do you have to jump through? Okay. If they're big hoops and you can, jump through it with, my body size, no problem. It's like, it was easy to go through. Okay. If they're rings of fire, now you might want to think twice about it as well. All right. So again, don't cut yourself out of the pie, to spite your face here, because you want to make sure that there's enough patients coming to you, or you have a large enough office that without that PPO, you can still survive. In some cities, in Decatur, Illinois, where I practiced there were about 11 chiropractors for 90,000 people. Okay. Where's Decatur, Illinois? Forget it. I'm not going to tell you. Okay. But the key is, In other places like Colorado Springs, you have one on, or maybe two on every single corner. They're like gas stations there as well. Okay. And so, but even if those employers now have a certain PPO, is there a per diem cap? If the cap is $35, it doesn't even really pay for a 98941. And then what benefits, how many visits per year? What's the deductible, as an example? Okay. Because healthcare costs are rising, and costs in general are rising, but healthcare costs are rising. So as an employer, the employers want to cut down the costs of giving healthcare. Let's face it, when an employee takes a job and they go, what benefits do you offer? Well, we offer healthcare, and we offer dental care, and we offer vacation time. They don't say, well, what kind of healthcare, what's the deductible? Is there a per diem cap? They just say, oh, you pay for my health insurance, but well, it's a $5,000 deductible. That doesn't help the patient either. And then they come thinking that, they're living paycheck to paycheck. Even in Medicare, when you look at Medicare, the congressional scramble around Medicare will probably continue each year, and that fee schedules are going down. In January, we have a new fee schedule for Medicare. In June, typically, we get a new fee schedule for Blue Cross. Now, you don't have to be a genius. Let's guess, how are the fee schedules going to be in 2023? Are they going to stay the same? Are they going to increase or decrease? All right. And I think you and I will come to the same answer is, I imagine it's probably going to decrease. So now, can you see enough patients that make up for that total amount of income you're getting per day? Okay. And so Medicare says one of the key legal issues is the extent to which the cash-only practice, they're actually onto us, okay? The extent of the cash-only practice handles services that are routinely or statutorily, which means by contract, covered by insurance, such as manipulation in Medicare. Well, Part B, Medicare pays for manipulation. Actually, nowadays, that's a whole nother class. Part C, Medicare in chiropractic actually covers manipulation, but sometimes even covers examination as well. And so the key is, what is the makeup of your community? And look at your patients in general and the kind of people you're seeing, and whether or not they're coming to you with insurance in hand, or are they mostly out-of-pocket patients, okay? Doctors always think that they can opt out of Medicare. This is like, if I could just brand it on everybody's forehead, you as a chiropractor cannot opt out of Medicare. Now, you can choose not to take Medicare patients, but when you have 67 million people currently on Medicare, baby boomers who have some money, expendable income, and they have chronic problems, do you want to really just say, sorry, grandma and grandpa, I'm not going to treat you, go somewhere else? And that means if a patient turns, Medicare patient, I'm turning 65 next month. So the first of the month of their birth month, they go on Medicare. You'll say, well, I'm sorry, I don't take Medicare. You'll have to leave. And, let's face it, a lot of these people are like family to us. So opting out of Medicare is not an option for doctors of chiropractic. Note that opting out of Medicare and being a par or non-par doctor are all different things here. You can be a participating doctor or a non-participating. And I think Medicare would have been done better if they called it in-network and out-of-network. But you can't opt out of Medicare. You're either in network or out of network here. Chiropractors may decide to be par or non-par, but they cannot opt out. And there it is, the MedLearn Matters. You can look it up. There it is. Don't take my word for it, okay? So the bottom line is that if you have a Medicare patient, even if you're doing services that are not necessarily, other than spinal manipulation that are not necessarily covered. If the patient says, I want you to file it with Medicare because I need the denial to turn it into my HSA, then you have to file it. And I will tell you, in my experience working with doctors all throughout the United States, when a patient complains to Medicare and the chiropractor is not in Medicare and still seeing Medicare patients, the fines are usually about $90,000 to $100,000. It's just not worth it. So either, do it or don't. So the key is that if it's active care, you have to file with Medicare for spinal manipulation. If it's active care, within 1 year from the date of service. But if the patient asks you in that year from the date of service, no matter what the service is, if they ask you to file the claim for them, you must do it. You can't say, well, you can file it yourself. No, you have to file it for them. You're still under the same requirements here, but the key is my practice was 23% were Medicare, but about 85%, 80% of those people were all maintenance care, GA, and they paid cash as well. Okay. Now let's consider you the doctor. Okay. Or if your staff listening to this, go back and you got the doctor's ear and tell the doctor, you got to consider this here too. Doctors, let's face it here, our costs of running a business are going up. Inflation, it's at an all-time high. And for the last 40 years, we have not seen this type of inflation. Look at the price of gas, the price of food, everything else here. And of course, staff, I live currently in the Phoenix area, and McDonald's is starting at $17 an hour here. Well, staff, they say, okay, price of gas and the price of childcare, I need to get paid more. But your reimbursement goes down. So what do you got to do? You have to see more patients, or cut costs here. So the key is that those unforeseen, and this says here, $34.16 per hour in the South, up to $42.31. You go, well, I don't pay that myself. No, what about those unforeseen costs, such as FICA, Social Security, the benefit plans that you give to your staff? All right. And of course, staff training, and your staff needs to be trained on a yearly basis as well. So get them trained as well. Okay. So when we look at all these different aspects, and then here comes the patient. The patient expects to get premium care, but I'm on a fixed income, right? Do you ever notice a patient that says I'm on a fixed income? If you go to a nice restaurant, they're ordering, porterhouse steak or filet mignon, and you're getting chicken tenders, right? But the bottom line is that we don't see how many people are living credit card, month to month. Maybe some of you are as well. And the key is that when, and this just came out in January of 2022, mortgage rates are going up. Auto, buy even a used car now, it costs so much. Student loan, that's in all that debt is in the news all the time. And, we're going to forgive student loans. Well, somebody's got to pay it. It's going to be your taxes here. And the key is that credit card debt is going up. People are, they don't have enough money in the bank to even pay for an emergency if they had to. So when you look at the laws and I'm going to talk about a cash practice here, of course. When you look at the laws of the cash practice, there's certain regulations, rules, laws you can't get away from. Number one, you have to have a compliance program. And you can say whatever you want. You can stick your head in the sand and all you get is dirty ears, right? Because you got to have a compliance program. So number one, do you have a compliance program? Do you have a HIPAA manual? 2 manuals required in your office. If you have that, great. But when was the last time you opened it? When was the last time your staff were trained? You see, and compliance issues, I teach for ChiroHealthUSA, of course, Foot Levelers, NCMIC, but get your staff trained, whether it be, online or take them someplace here. But the key is, have you trained your staff on HIPAA this year? We went through some major changes with HIPAA this year, and we're about to go through the privacy policy changes as well. Okay. That's a whole nother class as well. But the key is that your staff has to be trained. Okay. So if you need manuals here, there are resources. You can go to askmario.com. I always take things and run it through the chiropractic filter, and this is for the chiropractic profession. And, I'm just telling you, if you want for this group here, I have a special promo code on checkout. You could do bundle it, all one word. You get free shipping. You get a discount price. It's a good savings. So go to Ask Mario. We'll get that shipped out to you. And then we send all the forms to you. You don't have to pay extra for forms. I'll send it to you all electronically, and you can have it in your office. Get compliant, because that's risk management. Okay. If I was Dave Ramsey teaching a financial class here, that's what risk management is. It's covering your assets, right? So the key is, if a cash practice is most often sued, well, then you better look into risk management as well. Okay. So in a compliance program, there are 7 elements. I'm not going to go deep into this here, but number 1, who's your compliance officer? Look to your left, look to your right. If there's nobody sitting there, it's you. Okay. So the key is, everyone should know you're the compliance officer. You don't have to be an expert on it. Just know who to call, know who to, do personal coaching. All right. I do that all the time here. Written policies and procedures. Again, I'm going to give you some coming up real quick here. And conduct internal monitoring and auditing. Hey, look at my notes. What do you think? I do that all the time. Okay. And, doctors send me 3 of their charts there. I look at it like a Medicare, PI, Blue Cross, even cash, whatever. And let's see if you're, doing things risk management properly as well. Okay. And so that internal monitoring and auditing that you see number 5 there, keep in mind that auditing, the government says, must be independent, objective, because we look for things and buzzwords that should be in there that might not be. And then when you find out, wouldn't it be nice, let's be honest, wouldn't it be nice for me to say, hey, doctor, in your assessment, it's better if you say this, because assessment is the most important part of your SOAP note, by the way. Okay, so say this, and then you'll be covered. Don't put 50 times patient is improving as expected. Then you go back and you make sure it's done. That's what monitoring is, you see. HIPAA, all right. Front desk, okay. Front desk is like HIPAA Central right there. They're talking to patients. Patients are, they're giving forms to patients. They're on the phone, the front desk. Patients are listening to every conversation there. And that's why you got to do a risk assessment. Do you have a privacy policy? Is it on your website? Is it hanging in your reception room? Do you have the No Surprises Act notice? You'll learn about that coming up right now. Okay. And all that should be on your website as well. And so the most appropriate means of a compliance program here for any covered entity is determined by assessing it in your office. So, do like a risk assessment of things that I'm talking about even today. Just like if you call a patient, hi, is John there? No, he isn't. Can I take a message? Yeah. Can you let him know he's got an appointment at our, chiropractic office? Oh, I didn't even know John was taking chiropractic, getting chiropractic treatment. Well, if John didn't tell you that you could divulge that information to somebody, that's a HIPAA violation. That's why, update those emergency contact, my wife or my daughter, whatever. Why would they call me? Well, number one, if something happens to me in the office, but how about the doctor gets sick, there's a snowstorm or power outage or whatever else, okay? Do you text your patients? I don't care if you're cash or totally insurance or PI, to text the patient, you have to have written permission. Oh, well, it's in our privacy policy, but I had one case where the patient, 74-year-old patient, said, I'm not signing this acknowledgement. I didn't even see your privacy policy. And the doctor actually called me up and he goes, the patient wants to see our privacy policy. I go, yeah, well, don't you have it hanging in your reception room? No, we don't have one. Well, just giving them an acknowledgement of the receipt of the privacy policy is not a privacy policy. So when was the last time you updated your privacy policy? Okay, so do you have an open adjusting area? You have to have permission from the patient acknowledging with a signature that they know it's an open and adjusting type of situation. Then we look at the money, financial situations as well, okay? Keep in mind, we like to be good-hearted. And when you are working with patients here, Medicare says that if you do something that can induce a patient to stay or come to your office, that may be considered a gift and inducement, and that therefore has a fine to it because it's unfair trade. You go, oh my gosh, yeah, but it doesn't matter. Now, is it just Medicare? I will tell you, the federal government has the anti-kickback statute, and most states have the anti-kickback statute as well. So when was the last time you read your administrative code for chiropractic in your state? And you would be surprised because they are the ultimate authority because they govern your license as a chiropractor here. Okay. The statute defines remuneration to include, without limiting, waiving of copayment and deductible amounts, or providing services, items or services to a Medicare patient for free or for other than fair market value. Okay. That is a up to $10,000 fine per occurrence here. Now, can't I give anything to the patient for free? As number one, yes, as long as it's not over $15, and you can do it 5 times per year. Well, that's an aggregate of $75. You see? But the key is sometimes the doctor is just oblivious. And it's like, oh, you don't have to pay, or we do a payment plan and you get this for free if you pay up in advance. All right. Keep in mind, what are your state laws pertaining to advertising, pertaining to payment plans? Those all can be an issue here. Okay. As an example, in Texas, you give anything for free or other than fair market value, you have to actually have the items listed of what are being provided to the patient. In other words, it's not just an examination. What in the exam are you going to actually do? In Florida, if you are providing x-rays at a discount, number one, you have to tell what the normal price would be and what this price, and then you have to have a disclaimer that says x-rays will not be taken unless medical necessity is shown. So again, know your state law as well. In financial policies, I will tell you, why should a cash patient pay our full price? And ask yourself, doctors, in your office, whatever you say is and we call it the charge master, and that is like your actual price. So if you're doing something, whatever it might be, for $275, who actually pays the $275? I had one doctor who told me, well, PI cases. okay, personal injury. And then when we looked at it, the lawyers are constantly cutting the PI reimbursement down. So the key is now you go to your patient and you're paying cash. Well, you got to pay our full price, $275. And the patient goes, what? That's ridiculous. I'm not paying that amount for whatever service, as an example. Okay. And then have you heard of ChiroHealthUSA? Now, what discount, doctor, do you want to give to your cash patients? And I'm not going to set fees with you. That's for you to decide. But if you talk to the people at ChiroHealthUSA, our office, patients love ChiroHealthUSA. In our office, I'll say, have you heard of ChiroHealthUSA? And they'll go, no, I haven't. And I'll say, to be honest with you, you have no insurance coverage. All right. But since you have no insurance coverage, I have to charge you full price. But I agreed to take a reduction for a person with insurance. So therefore, I want to help you out. And so therefore, I'm giving you a reduction just like I do my insurance PPO people. And we're going to give you a reduction. And therefore, it'll be passed on to you. Now, you might be saying, well, isn't that a dual fee schedule? Yes, but a dual fee schedule is not allowed except in a managed care program. Well, ChiroHealthUSA is a discount managed care program, and the patient actually buys the program. Now, you don't have to pay for a doctor. It's $49. It's perceived value. The patient's getting a discount. Okay, but now you can pass on those legal discounts to the patient. And when I tell a patient, normally this is our charge here, exam and x-ray, your first visit, even your Medicare patient, Medicare approved this, and you'll save $180 today. They go, well, if I pay $49, I'll save $180. Yeah. Well, what's to think about? They literally say that. What's to think about? You see? And the key is that have consistent protocols and procedures in place as well. And so, ChiroHealthUSA, we call it CHUSA, ChiroHealthUSA, eliminates the issues of that dual fee schedule and applies to a patient who doesn't even want to use their insurance as well. And it is considered a managed care program. Now, January 1st, 2022, we had a law a regulation that was passed called the No Surprises Act. Let's put it in perspective here. If I am going to the hospital for a procedure and the doctor is doing the procedure, I know my doctor is in network with my insurance. I know the hospital is in my network with the insurance. But what about that one doctor who always comes to me and I see them for a little bit, have their mask on, their surgical outfit, and they always ask me to count from 100 backward. Okay, the anesthesiologist. The next thing I know, I wake up and, who knows what happened, right? But the key is, what if that anesthesiologist is not in network? And now you pay the full price and you get a bill for anesthesia for the procedure, $18,000. Imagine how you would feel. Well, that's why those surprise billing, it actually spurred what's called the No Surprises Act. The No Surprises Act will ban, and it will ban out-of-network charges without advance notice. So if you have a cash practice, you're not in network with the patient, or you don't accept these services, or services are out of network here, you got to inform the patient. Well, Medicare, even Blue Cross, Medicare has the ABN form. Medicare has the NEMB form, and you can even make your own form. But what about if you don't take Aetna or Cigna or Blue Cross? You see, now it kicks in and you have to inform the patient in plain language what your fees are going to be here, okay? So that way it protects patients who either don't have insurance coverage, don't have for chiropractic, don't have insurance, or elect to self-pay. All right. Now, if a patient has, let's say, a $10,000 deductible, they still have coverage and they're responsible for that deductible, but the No Surprises Act doesn't kick in at that point there. Okay. So there's two things I want you to realize. You have the NSA, No Surprises Act, NSA notice. A notice has to be on your website and posted in your reception room at check-in and check-out, whatever. And it just says you have the right to be informed. In our HIPAA book, my HIPAA book at askmario.com is the website, askmario.com. In our HIPAA book, you get all those forms electronically as well as in writing here. And so that is a notice, but then you have to give them an estimate of their charges. Okay, how quickly do you have to give it to them? Before they come into your office, you see? And so that way you have to, I call it insurance triage. And you tell the patient, okay, when was the last time you saw the doctor? Oh, I ain't never been here. Okay. And what kind of problems are you having? My neck and back are killing me. Okay. And what type of insurance are you going to be filing with? Okay. I have Aetna. Oh, I'm sorry. We're not in network with Aetna. Oh, you're not? No, we're not. And I'd like to email you our expected costs for the first visit. Now you have to put in your expected costs. So doctors go, I have never even seen this patient. How do I know what I'm going to do? Well, aren't you going to do an exam? Do you typically x-ray the patient? Okay, what are the ranges of costs for exam and x-ray? Now, once you see the patient and then you do a report of findings, now you'll say, okay, based on your exam, x-ray report, whatever you do, then this is the treatment plan. This is what it's going to cost you. And the patient has to sign it. Okay. Now, the key is it, again, requires that the healthcare providers give an easy to understand, and there are actually templates available. You can get them from the government. They're also in our HIPAA book as well. Okay. So the key is a cash practice, you're going to be really affected by the No Surprises Act. Now, here's the kicker. What if the patient goes on ChiroHealthUSA? Well, it's a managed discount care program. And so therefore, they buy the program, $49, that goes to ChiroHealthUSA for administrative fees. You don't have to pay anything, doctor. Yes, you're going to take a reduction, but you already do that in a PPO and you're helping out your cash patients. You go, well, what about a time of service discount? The Office of Inspector General said that in general, time of service discounts should never exceed 15%. Some states say 5%. What does your state say? Okay, now, if you're giving a 30% time of service discount, it may be construed as an inducement, illegal. Okay, now, you don't want to undershoot. You want to give them as accurate a price, and $400 is the limit. In other words, if I say it's going to be $100 and it's $500, now you've gone over that threshold. The patient has a right to complain, and they can file a claim there. And guess what? If the government says you violated the No Surprises Act, what do you think the fine is? They can only count up to $10,000. It's $10,000 fine for almost everything. All right. So the key is, does the patient have insurance? Are there benefits? Are they, do they want to pay self-pay? And the bottom line is, if they don't have coverage and now they're on No Surprises Act, then ChiroHealthUSA is a viable solution for you. Okay. So here, providers are required, and as I said, prominently located in the office where patients can see the posting on your website. That's number 2. Okay. And also orally on the phone when they call. All right. And so therefore, know who your patients are that are affected with the No Surprises Act. If they're not under ChiroHealthUSA, then you want to make sure they're being informed of their prices before the services are furnished, and also have the signature. It has to be in writing. But if they go on ChiroHealthUSA, that you put away that No Surprises Act because now they've elected to go with that act. Okay. So a good faith estimate, those estimates there, you have the name of the patient, you have a description of the services in a clear and understandable language, an itemized list of the items or services. And really what you think about them, you don't have to read slides here, but if you think of 3 columns, the name of the service, the CPT code or ranges of codes, and then the price or ranges of price. That's basically it, you see. And then the patient here, you could list a diagnosis code, but if you know it, but the patient then will acknowledge that these are the costs and that they're going to enter it in there. Now, on the good faith estimate here, you also want to enter in, as it says here, the first name, last name, and title of the doctor, providers, or your corporation name. You can put your logo there if you want, your address, city, state, zip here, as well as the tax ID number and NPI number. So if you're using this, are you doing it properly again? Okay. Again, the list of items or services on the good faith estimate and how much is expected to be charged. Okay. And then there are disclaimers that basically says that, you can elect not to have this, or if things change, we'll let you know here, as well as you have a right to complain. Those are the 3 disclaimers on there as well. Okay. All right. And that's what I just explained on these slides right here. Okay. All right. So what insurance are you in now? Is it really viable for you to be in that insurance? Does it even cover chiropractic care? Is there a per diem charge, like 35, 45 here? Is this something that meets with your approval? If not, you can negotiate with the insurance company. Good luck on that. Or, decide whether or not this is viable. It's a business decision. Okay. And you could have a hybrid practice too. Obviously, you can't opt out of Medicare. So the way I look at Medicare, it's straight chiropractic. It's spinal manipulation, active care only. Anything other than that, maintenance care and other services are cash. Do you have to do the No Surprises Act for Medicare? No. You have other forms such as the ABN form that takes care of that. Okay. And so have that on your website, in your office as well, not your price list, just the No Surprises Act notice. Okay. That is a very misunderstood area. And again, have that at check-in, check-out, as well as on your website as well. Okay. All right. So, and we've talked about this here, so I'm not going to go on. Now, again, that Medicare gifts and inducements, remember I told you about the remuneration here, but also consider, are you paying for referrals? That's and that's part of the anti-kickback statute, because you cannot pay for referrals. Oh, Mrs. Jones, you write a thank you note. Oh, let's put it in writing so we really make sure we get in trouble. Thank you for referring Mrs. Smith to our office. The kindness you have shown by referring others is greatly appreciated. Please accept this coupon for a free adjustment on your next visit. Hurry in since I'm going to federal prison. You can't do that. You cannot pay for referrals. And I've seen all kinds of schemes. As Dr. Foxworth, our founder of ChiroHealthUSA says, DC sometimes stands for Doctor of Chiropractic and other times for Doctor of Creativity. All right. So the bottom line is, you can't pay for referrals. You can't have a referral system. Everyone that you send in, you get a raffle ticket, and then we send you to Jamaica. You're going to Jamaica. I'm going to federal prison, man. No, you can't do that. You cannot pay for referrals. I've had attorneys call me. I'll send you PI patients, but you got to pay me a finder's fee of $150 each visit. I mean, each patient. No, that is illegal. You cannot do that. That's all part of the anti-kickback statute that makes it a criminal offense, knowingly and willfully offering, pay, solicit, or receive any type of reward, remuneration to induce or reward the referral of items or services. Okay. All right. So that's why, they've got the inducements of, the 1575, but keep in mind, under no circumstances can you ever give away services or for referrals. Okay. Even if you're going to do something like a coupon like this here, check your state law. I don't care if you're cash or not, doing functional medicine and not manipulation. It doesn't matter. What does your state law say? Those coupons will get you in trouble. Okay. And then of course, risk management, you got to do documentation. If you're doing paper records, fine, okay? You do paper records, whether it's paper or electronic health records, you have to conform to the standard of care. A lawsuit doesn't care what insurance coverage you get. They just want to know if you are, negligent or not. And so you are bound by the standard of care, which is the type and level of care an ordinary, prudent healthcare professional with the same training and the same experience in our community would do under similar circumstances. And it doesn't matter, even if it's a cash practice, you're still held under the standard of care. So you have to do SOAP notes. You're not getting out of SOAP notes. If you don't want to do SOAP notes, fine. Go work at Home Depot. It doesn't matter. They're hiring. Okay. All right. But the key is you got to do SOAP notes. How quickly, I will tell you, the standard of care is you get those notes done within 48 to 72 hours. Who's going to know? Well, if you're doing it in a computer, they will always know when you entered in those notes because it's on the hard drive. You can't change that fact. Okay. And then what you put in there, it's not, garbage in, garbage out. It's not what you put in. It's the quality of the note. And, always code based on your documentation, charge the patient the proper fee, the proper code here, and don't pay for referrals as well. Okay. All right. Notes have to be legible. I love this cartoon here. The doctors are on strike, but nobody knows why they're on strike. Okay. Because of their placards there. Okay. This is actually a past client of mine. Now, this is not, you'll say, well, is this a HIPAA violation? There's no information on this. It's worthless. Okay. He even told me, he goes, you can use it, tell them I'm reformed. Okay. But the key is that's not going to protect you. You're going to lose your house. You're going to lose your shirt. You're going to lose everything. Okay. So the key is, even in a cash practice, you got to do proper note taking too. If it wasn't written, it wasn't done. If you can't read it, it wasn't done. If you can't find it, it wasn't done. If it's not filed in the record, it wasn't done. If it's not ordered, it wasn't necessary. And if it's not signed, not initial, signature, you didn't do it. I know there's a lot to do in a practice here. It's not just reimbursement. You still want to know the rules and regulations. EHR makes it very easy to carry over, but it's like, okay, did you do blood pressure every single visit? You wrote here the blood pressure was, 212 over 98. And you set it for 58 visits here, and the patient had a stroke. Or you said over and over again that you did the straight leg raise test and you just carried it over, or you just totally cloned it here. You can't do that. That's all considered to be fraud. Peer reviewers, when I talk, I don't do peer review, but when I talk to peer reviewers, they say they always look to see, first thing, did the doctor sign the notes? If not, denied. Lawyers, first thing they do is look to see informed consent. Cash or no cash, okay, insurance or cash here, you still have to get in a proper informed consent. What are your state guidelines for informed consent? It is state controlled. And so you have to properly communicate the side effects. Thankfully, we don't have too many, we don't kill our patients typically, right? Okay, but the key is the most common side effect of manipulation is muscle soreness. So what does your state require for informed consent? Check with your board of examiners for your state, check with your malpractice carrier, check with your state associations as well. And so it's inherent or foreseeable, that some states, as an example, in the Carolinas, I think it's North Carolina, requires you to talk about vertebral artery dissections. California, you got to talk about relative risks. Colorado, you have Rule 21. Okay, so the key is that we all have to answer to a higher power. So there's a lot of different laws that still affect the chiropractic practice. The Medical Practice Act, which is, your laws in your administrative code in your state, your licensing requirements, the Board of Examiners in your state. I've testified in front of the Board of Examiners, trying to help doctors out before. Of course, you have the False Claims Act, Reverse False Claims Act, the Anti-Kickback Statute, HIPAA, the Gifts and Inducement. It's all these laws. And I know your head is buzzing and everything, but the key is if you do it once, it's usually done. Like the No Surprises Act, you put everything in place and boom. Okay, until the law changes, hopefully it doesn't change, several times in a year. But the key is if it does change, where are you going to find out if it changed? Facebook.com/AskMario. Don't procrastinate. Do it. Okay. So what's the solution here? Okay. Well, keep in mind, you have to decide if a cash practice is really the answer. What kind of practice do you want, doctor? I've just told you all the things and you can't run away from it. It's like death and taxes is just, you can only cheat it for so long, right? But the key is for your office, your patient makeup, your philosophy, what kind of patient load do you want? That's what you got to consider when you're looking at a cash practice. When you get down back to what is the purpose of chiropractic care, the key is our communities need us. We are providing a viable service for our patients, and your patients appreciate it. It's a long road. This is, I should have named my clinic the last resort clinic. Doc, you're my last resort. When they finally get to us, you don't want to turn them off with high financial bills or with all these deals, and then staff is confused. It's like, what deal do they get? Do they get the pastor's discount or, the last Tuesday of the month discount or whatever here? So the key is you gotta be consistent in your policies and procedures. I know we're not just low back pain doctors. My daughter took this picture of this person here, and it says Sons of Arthritis, ibuprofen chapter. Okay. That's like, Arizona, Florida, God's waiting room here. We're not just low back pain doctors, but I'll tell you, L5 bought my house and C7 put my kids through college, So the bottom line is give a good service, but now do it in a way that is profitable to you, that you don't have to have 50 employees, but that you're allowed to, sleep at night. Now, I'm in a 55 and older community. I just barely got in. I'm just kidding. Okay. But the key is, we actually have waiting lists for pickleball. We have waiting lists for yoga classes and strength and conditioning classes. Your patients nowadays are active. They don't want to live with pain. And look at, we have an opioid crisis. We have, people on heroin. Fentanyl deaths or poisonings are up. And so the bottom line is you give a service that is viable for your patients here. Remember, we can get bogged down with all the insurances and everything else here, but how can you take care of your patients properly and keep them off of those opioids here? For our community, why did you become a chiropractor? Overdose deaths jumped over the pandemic. And now with fentanyl poisoning, it's not overdose, it's poisoning in the drugs here. It's horrible. So roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them, and then they develop an opioid use disorder. 4 to 6% who misuse opioids transition to heroin. About 80% of people on heroin first started off misusing opioids. So you got to train your patients. You got to educate your patients and decide how to implement the policies and procedures I went through. But your patients who are coming, who elect to pay cash or have insurance that is insufficient, keep in mind, we are not responsible for the insurance our patients bought. We are not responsible for the insurance our patients bought. And so according to your insurance carrier, you don't have coverage, or, you have a $10,000 deductible. Have you heard of ChiroHealthUSA? It's not a money-making scheme. Yeah, it will help your patients with compliance and therefore they stay in your office, but it's a win-win. You and your patients can win. All right, so hopefully look at your philosophy here. What type of practice do you want here? You can still offer items or services to take care of your patients properly, but re-examine why you got into chiropractic and re-examine the treadmill that you're on and how you can do this more efficiently here. And I will tell you, as I talk to doctors around the United States here, how many of your patients that you saw today or yesterday, how many of them were already paying you cash? You might already have at least a hybrid practice, if not a cash practice here, but do it legally. Follow the rules and regulations. Now, I'm going to take some questions here for a couple minutes here, but I'll leave you with this thought here. The secret of success is to find a need and fill it, to find a hurt and heal it, and to find somebody with a problem and to offer to help solve it. So I thank you very much here. And Christy, I'll turn it over to you. If any of you you need resources or help here, ChiroHealthUSA, I talk to them almost on a daily basis, one of them there, but also I'm available to help you out here. My email is doc@askmario.com. And you might want to look at our website, askmario.com here for any manuals that might help you. Okay. Christy, that's all I have here, so I'll turn it over to you.
Perfect. The first question is, when a patient becomes Medicare age, do we have to dismiss them if we do not work with Medicare or submit?
The answer is yes. But keep in mind, if a patient is your patient and now you are dismissing them, the method that you dismiss them, a patient, you may be vulnerable for abandoning your patient. And that's why when it comes to Medicare, if you're seeing, and I've had doctors say to me, well, I don't take Medicare, I see Medicare eligible patients. No, you're seeing Medicare patients, and therefore you have to be approved by Medicare as a provider. But again, Medicare only covers active care, which is typically 90 days of care at the most, and only spinal manipulation.
Okay, well, that brings me to this question. Does Medicare still have a limit on the number of CMTs each year?
It depends on your carrier. Now, Novitas will, depending on your diagnosis, okay, if you're still using cervicalgia, it's lumbago with vertebrogenic or whatever, or unspecified, get some therapy, okay? All right. That is not a diagnosis. Cervicalgia saying, oh, you have neck pain is not a diagnosis. But if you use a long-term diagnosis, up to 30 treatments, which is a lot of treatments in my book, but in most carriers, Noridian, NGS, and so forth, there is no limit, 365 because it's one per day. Okay, so if you're in an area like Mississippi with Novitas, then you got to reevaluate what diagnosis codes that you're going to be using.
Let's see. For Medicare, may an office have a food drive, bring in cans of food, and receive an adjustment?
Okay, so an adjustment normally costs more than a can of food. Now, I'm not a lawyer, but it may be construed as an inducement. Okay, I would tell you, in my opinion, that the exception is Medicare and Medicaid, depending on your state's coverage of, you can't do that for Medicare patients, period.
Okay. How does a place like The Joint get away with seeing Medicare patients?
Well, I'm not going to address a specific franchise, but I'm not going to address a specific franchise, okay? Yeah. That's all I'll say.
Okay. Is discounting a cash fee for students under 18 or elderly over 65 for maintenance care, not Medicare covered adjustments, is that considered against the law?
Well, it may be construed as an inducement. It may be construed as a dual fee schedule. And also keep in mind, like even a time of service discount. And Christy, you're welcome to add in, because I know this is up your wheelhouse too. But if you are giving a time of service discount, not over 15%, it must be listed in your financial policy. Okay. The bottom line is it most commonly will be construed as a dual fee schedule.
I would absolutely agree, because regardless of the age of the patient, if you look up, say, the description and the requirements for 98940, it's not age dependent, patient size dependent. It doesn't matter if it's a newborn baby, a 35-year-old baseball player or a 65-year-old grandmother, and a 1 to 2 region and adjustment is a 1 to 2 region adjustment. So whenever you have this, well, it's this price if they're 65, this price if they're under 5, then you have a dual fee schedule.
Right. Keep in mind, the only time you can have a dual fee schedule is under a managed care program, which if they are not in insurance or you're not in insurance, then you got to get them under ChiroHealthUSA to keep it legal. That's why literally CHUSA has jumped through the hoops to make the program legal.
Yes. And under your CHUSA contract, you can set fees for family members, so that, and if you choose to define the family members or ages of children under the age of 18, that's up to you, but you'll work with a network specialist to help you in establishing what's best for your practice.
Can I be honest with you folks? I've known ChiroHealth, I've known Christy forever, for probably all the decades she's been there. Okay. But it was like in my office, it was like, explain this to me. And when we start implementing it, it was like, I couldn't believe how much patients like it. And you know what? It's like ChiroHealthUSA. I can't think of a single patient in our office who's pure cash paying the total fee, because it's like $49 and then you get a discount, a legal discount, and ChiroHealthUSA will talk with you about getting that legal discount. There's no such thing as a pediatric adjustment. It's 989-40-4142 or 43. How much do you charge? You see, and that's the fee that they pay unless they're in a managed care type of situation, such as ChiroHealthUSA as well. Okay.
I love that. And it actually, I'm not ever surprised because I see so many people who charge based on age, and that's like a whole coding issue. Okay. So I have patients who choose not to use their Medicare when they turn 65. What would be the process for these patients?
Well, if they choose, and remember, like one doctor had the ABN form with option 2 already blacked out there. No, that's prison time, okay, for the doctor. All right. If they choose not to use the Medicare, then they have to personally choose option 2, sign and date the ABN form. All right. Get it one sign each year is what I recommend. Okay. And then at that point here, you have the Medicare rate, or you have the your full rate. But if you're a provider with Medicare, then Medicare still gives you the rate. Okay. In other words, if Medicare is reimbursing $27.85 and it's a maintenance visit, you can still charge that patient the Medicare rate. It's when you go in between and start doing the deals, then it smells like an inducement. And if it smells like an inducement and it looks like an inducement, it's probably an inducement, $10,000 fine per occurrence. Okay. The bottom line is call ChiroHealthUSA and just say, this is what I'd like to do, and how can I make it legal? That's, I know them. I have no financial gain if you go on ChiroHealthUSA or not. I just know that my wife, my doctors, my staff, if they have questions, they call CHUSA. Okay. We're there. And if they don't know, they call me. Okay. So the bottom line is somebody's going to find out the right answer for you.
Okay. So I'm the only female activator doctor within a 60-mile radius of some patients. I was told because my patients have no other comparable option, I am still allowed to see them when they turn 65. Is this true? So I asked the person if they had it in writing and who told them that. And they said another professional, a licensed counselor, and no, they don't have it in writing.
No. I'm sorry. That's not right. Okay. If you are the only provider in the county even, or whatever location, all right, that is an area that is, and I can say this with certainty because that is an area of a health physician shortage area that Medicare actually pays more for the manipulation, up to 15% more than their fee schedule, because you're the only chiropractor in the area. And it doesn't matter on technique. Okay. So you can look up the health physician shortage area in Medicare and see if you qualify. All right. But that doesn't mean you can opt out of Medicare. And that's, I'll base my answer on that, because in areas of physician shortages, Medicare pays more, but they don't give you the option to opt out of Medicare. And I know that for a fact.
Okay, the next question. You just said you can charge the Medicare patients the Medicare charge if they choose option 2. Can you not charge them the full price?
Oh, you could. Medicare, and it is a gray area there. Okay, Medicare says, spinal manipulation, maintenance care is not a covered service. Therefore, you can charge your normal rate. Now, the American Academy of Professional Coders, 300,000 people, and I'm certified with them as well, so they're a big entity, and they say if you're under contract with Medicare, either as a par or non-par doctor, then you have that fee schedule to you. Okay. Me personally, even my Medicare patients who were under maintenance care, I charge them the Medicare rate, because if they fall and now they're active care and exacerbation and they're active care, now they don't see the fluctuating costs here. We make it simple and legal too. Okay.
Okay. Why can't you use your standard charge master for both insurance and self-pay and apply a self-pay discount similar to insurance? How would this be considered illegal?
Well, it's not a managed care program. Okay. In other words, if it were in a managed care program, all right, the way you have it set up here, and you're asking a specific question, we'll have to look specifically at what you do in your office here. And Christy, this, you folks do this all the time. Typically, it's going to be either federal or state law that says that this is considered to be an inducement.
Yes. And then on top of that, you have to look at the type of discounts that are given for a self-pay or a cash patient versus the type of discount that a patient gets because they're part of an insurance network is significantly different. And the OIG says that a reasonable time of service discount would be between 5 and 15%. So if you're offering 50% discounts because the patient doesn't have insurance or they're self-pay or a high deductible, well, that just gets into a whole mess of stuff.
And you hear me now, believe me later, okay? But the key is, we're not just saying this. This is in writing. It's an advisory opinion from the government that says a time of service discount cannot be over 15%. Otherwise, it's considered to be an inducement. Okay, if it's my opinion, I'll tell you. But in this case here, it's based on fact.
We're going to take one last question. How would you appropriately handle an active care Medicare patient who does not want anything billed to Medicare?
That's easy. You go, no problem. Here's the ABN form. This is the form instructing us not to bill Medicare. Under HIPAA, you can restrict any disclosures. If you do not want us to bill Medicare for any services, mark option 2. Now, doctor or staff, whoever is asking that question, keep in mind, I call it buyer's remorse. The patient can come up to 1 year later and say, I changed my mind. I want you to file it with Medicare. Okay.
I was just going to say that, because I think the biggest concern here is you can't have every Medicare patient want to not opt out of you billing Medicare. Yeah. And they have the right to change their mind, which means you have to be registered with Medicare so that you can bill Medicare should they change their mind.
Yep. Yes. All right. And again, there's a lot of questions, which is great. That means we hit a good topic here. Okay. So if you have follow-up questions, Christy's doing nothing. She's just sitting around. No. Okay. You can ask ChiroHealthUSA, but my email is right there on the screen, doc@askmario.com. Send me an email. Let me know you were in the webinar here. Okay. But if you need manuals, which are required, it's not a recommendation, it's requirement. You can go to askmario.com as well. And remember that bundle it promo code. We have that in place here for you folks. And so you can use that and get a discount, and we'll get those mailed out. Okay. All right. All right. I think that's it. All we have. So if you have any questions, give me a call, or better yet, email. Christy, anything else?
No, thank you so much for addressing this hot topic. I know there were a couple of questions that didn't get answered. Rest assured, I've already emailed them over to Dr. Mario, so I'll get those answers to you guys shortly. Some of them have already been asked, but we'll make sure that your specific question was asked if you send it to me privately. So thank y'all so very much. Have an amazing rest of your day and a fabulous week.
Okay, take care. Thank you. Bye-bye.
Bye-bye.